holiday season is in full swing, and young people across the country are looking forward to taking a break from school and spending some extra time with loved ones and family. But with mental health concerns on the rise, the holidays are a good opportunity for loved ones to check in on their child's mental and emotional health. So joining me right now here in Studio 61 is Laura Maloney with Pro Health Physicians. Laura, thanks so much for being with us.
Thanks for having me.
All right, so recent trends show a significant uptick in substance abuse in young people. Knowing that, keeping that in mind, what do parents need to know and sort of start to plan as we do want to have conversations with our kids?
Well, I think the most important thing is that parents have open lines of conversation with their children and adolescents, because doing so will help them kind of be available for those conversations, as far as, you know, making sure that they know that their child can talk to them about anything. And if they know that, if a child knows that, then they are more likely to come to their parent or guardian.
Now, for a parent who may not have had that conversation much or as much as they would like to, what's a good way to start? I mean, someone might be thinking, do I just blurt out, like, do you do drugs? But is there a better way to lean into it for someone who's maybe not familiar with or comfortable with that conversation?
I think, you know, maybe not that approach, but it's not a bad idea to start having that conversation earlier.
Just be blunt and honest.
And not necessarily blunt and honest, but sort of starting to talk to kids about drug and alcohol use and versus just going ahead and having that conversation earlier on in like a younger, like 10, 11-year-old child. Of course, if they have concerns about drug use, then yes, broaching that conversation.
And how would that conversation shift for older children, kids who are, you know, adults now and they've gone off to college and certainly been exposed to those things?
Well, it is a little bit different. I mean, especially at that age, they certainly have a lot more of privacy. So I would say having more of probably a direct conversation in bringing their concerns to their child at that point.
And you've worked in addiction services for more than a decade. What are some of the warning signs that parents, everybody, should be on the lookout for?
So as far as just in general for mental health and addiction for children and adolescents, if you see your child withdrawing, not wanting to hang out with friends and family, isolating themselves more, or seeing a decline in their school work, or also seeing them not wanting to go to school or doing things that they typically enjoy, those are some of the warning signs.
Now, from studies, we know that there's an increase in substance abuse, specifically for middle school students, and that's very shocking for a lot of parents. How do we approach that?
I think, you know, as I mentioned before, having that open conversation at an earlier age. As parents, we don't typically think about that age as one to start using substance, but having that conversation a little earlier and maybe talking to your child about safety as far as things that they might experience, and if they do or if they see something, to talk to them. And again, going back to that open line of communication, if you have these conversations early and your child knows that they can come to you, hopefully they will do so sooner and talk to you about those things.
Now, we do know that social media has an effect on younger kids, specifically their mental health and substance abuse. What should we be keeping in mind in that? Should we have more limitations? You know, sort of walk us through that as far as parents and what we should be doing.
Sure, absolutely. I mean, yes, there are very good guidelines out there for an older child between 5 and 17. It's recommended no more than 2 hours of screen time per day, not counting schoolwork, of course, but limiting that. And sort of parents, it is a good idea to keep tabs on what your child is viewing. Of course, there's a lot of stuff out on specifically YouTube that can have some really basically inappropriate for children. So absolutely monitoring what they're
appropriate.
Yes, exactly. And just really trying to limit it and not have unlimited access to screen time. And it isn't great for their mental health to have that amount of screen time as well.
Right. It's just always tough, I think, for parents to rein it in.
Oh yeah, absolutely.
For sure. It's like a constant struggle.
It is, absolutely.
Well, thanks for the tips and the advice. We do appreciate.
Of course, thanks for having me.
Important subject.